Domestic violence is the willful intimidation, physical assault, battery, sexual assault, and/or other abusive behavior perpetrated by an intimate partner against another. Violence against women is often accompanied by emotionally abusive and controlling behavior, and thus is part of a systematic pattern of dominance and control. Domestic violence results in physical injury, psychological trauma, and sometimes death. The consequences of domestic violence can cross generations and truly last a lifetime.
Domestic violence is defined as a pattern of coercive behaviors and methods used to exert power and control by one individual over another in an adult domestic or intimate relationship. This is also known as intimate partner violence or relationship violence. There are two forms of domestic violence. The first is categorized as psychological or emotional. This includes, but is not limited to, threats, intimidation, verbal attacks, insults, emotional abuse, and social isolation. The other form of domestic violence would be physical. Examples of this include battering, shoving, kicking, slapping, forms of torture, punching, and sexual assault.
In the past, domestic violence was known as wife abuse, conjugal violence, and spousal abuse. The name was changed to domestic violence because it was recognized that abuse was not just between married couples. Demographic characteristics such as age, number of children, ethnicity, and location have not been consistent with domestic violence. Domestic violence is, however, more common in families that are relatively deprived. According to Ladwig, London, and Davidson, domestic violence has decreased significantly in the past decade. There is not one reason why domestic violence happens, and it is not clear why some people are more violent than others. As an abuser, they feel empowered and in control, but there are many reasons as to why a perpetrator resorts to domestic violence. The best theory I found was a social ecology model by Heese, who gave a multi-dimensional explanation of what causes domestic violence. Some of the common causes at the individual level or the perpetrator level include intergenerational exposure to abuse, educational attainment, employment and income level, and social networks outside of the family. At the relationship level or the mesosystem level, marital conflict could be a problem, male control of wealth and decision-making within the family, and the family structure in the family. In the community or the exosystem, poverty and low socioeconomic position and unemployment is common, associating with delinquent peers, and isolation of women and family. At the society level, or the macrosystem level, the norms granting men control over women is common, acceptance of violence against women, rigid gender roles, and notions of masculinity linked to dominance. And finally, in the larger society, or the chronosystem, there could be gender equality, national laws and statutes, and the sanction mechanisms regarding abuse.
When a victim of domestic violence comes into the healthcare facility, there are common trends that the woman expresses to the healthcare providers. The women share that they are isolated from their friends and family due to the abuse going on in their home. The women are often submissive, passive, and dependent and seek the approval from the male figure in their lives. With this, the victim is totally dependent on her partner for financial and emotional needs. Not only do the women share that they are abused physically, but also psychologically. Nurses need to reveal if the batterer's words have caused the woman to believe the accusations made by him. They often believe they are inadequate, and that is why they deserve the abuse. Their self-esteem is severely impaired. Due to the repeated abuse, both physically and psychologically, The women express a pervasive sense of guilt, fear, and depression. Their excess feelings of hopelessness and helplessness cause their problem-solving skills to be severely impaired. Women may state that they cannot figure out what to do and feel like they can't figure out anything on their own. These women also feel like they have no resources because they lack the support from family, friends, and the religious community. Unless the victim of abuse has visible bruises, it is often hard to detect that a woman is suffering from abuse. Because domestic violence is such a large problem in today's world, nurses need to advocate for universal screening of all female patients at every healthcare encounter. It is key to maintain the patient's privacy throughout the evaluation. Common questions to ask include, during the past year, have you been slapped, kicked, hit, choked, or hurt physically by someone? Has your partner or anyone else ever forced you to have sex? Also, the healthcare provider needs to look for signs of abuse, including hesitation in providing detailed information about the injury and how it occurred, inappropriate affect for the situation, delayed reporting of symptoms, pattern of injury consistent with abuse, and also lack of eye contact and signs of increased anxiety.
When assessing, a nurse must be aware of some physical signs of injuries that might be related to domestic violence. There may not be any physical signs, but be aware of stress-related illnesses, depression or anxiety, sleeping and eating disorders, suicide attempts, and so forth. If domestic violence is suspected, separate the victim from the potential abuser or from whomever they have been accompanied by, if possible. Ask questions based on assessment. For example, do you feel safe at home? Or, are there ever times you are frightened of your partner?
When providing education for a victim of domestic violence, it is first important to give the patient a list of community resources and other healthcare agencies that were mentioned earlier. These can assist with many injuries, emotional, legal, financial, and housing issues as a result of domestic violence. It is important to educate the patient on the health risks associated with domestic violence, which includes risks for depression, suicide, drug use, and many physical symptoms. It is shown that women who are pregnant and abused only begin prenatal care in the 3rd trimester, and then there are many health risks for the fetus. Educating the patient on resources within the community, such as battered women's shelters, can help protect the patient and the baby if she is pregnant. Once the woman is out of the healthcare system, it is her decision to go back to the abusive situation or not. In this case, educating her and helping her develop an exit plan is key. It is important for her to understand that her abuser might be monitoring her every move, so everything must be done with great caution and in secret. It is essential for the patient to be informed of the likelihood that the violence acts will be repeated, and homicide is always a concern with battered women. If the woman is planning on escaping, providing her with a hotline number, police number, and other community resources can ensure that she has somewhere to go and someone to call if she needs help or is in a dangerous situation. In the end, it is the woman's decision whether or not she leaves the violent relationship. As frustrating as the situation may be for a healthcare provider, educating the woman on her resources and options can empower her to make the decision to get out. Being supportive of her decision is important, and assisting her at all times is what a healthcare professional can do.
On average, 24 people per minute are victims of rape, physical violence, or stalking by an intimate partner in the United States. Among heterosexual couples, in at least 95% of cases, the perpetrators of the violent acts are men. And here in the United States, 1 in 4 women have experienced physical violence by their partner.
According to Springfield Police Department, at the end of 2012, the Springfield Police Department had logged 2,476 domestic violence incidents for the year. This averages to over 6 incidents per day. The total amount of incidents had increased from 2,207 incidents in 2011. There are by far more victims of domestic violence in Springfield than local shelters are able to house.
Therapies for victims of domestic violence include medical treatment for injuries, temporary shelter to provide a safe environment for her and her children, counseling in an attempt to raise her self-esteem and to help her understand the dynamics of family violence, legal assistance for protection from the perpetrator, financial assistance to obtain shelter, food, and clothing, and job training for any future employment options. If a woman chooses to return to an abusive situation, it is also important to advise her to create an exit plan.
Nurses can play an important role in working toward the creation of a violence-free community. They must then insist the organizations in which they work to accept this responsibility and work together to create environments that support people experiencing domestic violence. The time to act is now.